All right, I'm going to start the treatment for the posterior part of the shoulder. So really important that when we're talking about treating the shoulder, there's a couple of different avenues that I go. The first place for me to always probably start is obviously having my clients in this prone position here, because there's just so much lovely stuff to work with in the posterior that definitely is a big part of a lot of rotator cuff dysfunction, especially if we're talking about trigger point world. But for the most part, it's more about let's getting access to some of the more subsidiary muscles first. So you'll tend to find, no matter if there's problems here in the rotator cuff, there's going to be some level of either tightness, load, tonicity, whatever the case, all the way through the lats, obviously in this interscap region. And you know, this is where I like to address first. I like to free up all these areas first, then take my focus to the back of the shoulder and the rotator cuff and all these wonderful areas that we'll visit and explore. But let's sort of do it broad first, then focus in, and then isolate what we do from there. And do a similar situation when we get my clients side lying, because obviously then I'm treating the lateral part of the shoulder, which will incorporate the triceps. And then obviously once we flip them over and we get them into that anterior position, then we've got all the other excitement and magic in the anterior ones with you know, the three sisters that I call the coracobrachialis, short-headed biceps, and pec minor. Right, because I'm all about safe, sustainable techniques, and you know that I'm all about that. When we're doing this sort of work here, I do not want people to be focused on using their fingers and their thumbs for these muscles. That's just going to really just put you in a really bad spot in terms of overuse injuries for your hands and so forth. So let's focus the most on. Love using the forearm here. I'm using the Premax Original Cream. The reason I'm using the original is the more sort of stickier of the brands that they've got. If I was doing broader strokes, I'd be using maybe the Essentials or the Arnica or or even the Activate. But because I'm actually going to be working a little bit more slowly and engaging the tissue, that's why the original is. So I'm going to come in with the fleshy part of my forearm first. So what I'm going to do is I'm going to pick up the upper part of the trap here. Okay, so I'm not chasing trigger points here. This is just about engaging in the tissue, maybe a little bit of fascial work, whatever that, depending on the speed that I work at. So I'm going to come up over that medial trap, and then I'm going to lie right into that levator scap area, and then obviously serratus posterior, and then into the rhomboid area, and then I'm just going to chase the rest of the lats down from there. And I'm working along almost into that laminar groove, making sure that pressure's okay. If it's not, I'll be feeling Dan pushing up against me, and then I'll fall off into that lateral trapezius, picking up a little bit more of the rectus spinae, and just following that all the way down, thoracolumbar, picking up a little bit of lat dorsi, and so on from there. Okay, so you get a bit of a gist. We're working all along that tissue there. So we're picking this up all the way down, working towards the pelvis. We can go about it a different way. Once again, if you want to, come up with a loose fist here. So picking up the same sort of tissue. Once again, all the load is going through my arm. Okay, so I'm not pushing with my shoulder. I'm not putting any undue tension through my wrist as well. And I'm just using all my body weight and working along that tissue, lower traps, down into lat dorsi, and then back onto the pelvis, all right? And then I can come a little bit more lateral. So I'm going to come off a little bit more lateral this time. So I'm going to work down again, making sure that I'm picking up now the lateral edge of the erector spinae,